Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, reporting for the week of December 14th. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you the information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the chat, by direct message, or send us an email at admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has over 38,000 cases, and there are 546 COVID deaths. Last week, there were over 32,000 cases. Now there are over 38,000. That big jump of about 6,000 cases in such a short time frame is very concerning. Now let's take a look at hospitalizations, which is even more worrisome. Hospitalizations continue to increase, and you see that this line is just going straight up like never before. The steepness of this curve is quite alarming. As of Monday, we have 302 COVID patients in the hospital. We have not seen this many COVID hospitalizations in Alameda County ever. In fact, we've been breaking the single-day record every day for over a week now. Remember, our previous peak was in July at 213. Now we've surpassed that by 89 people and are now at an all-time high of 302 COVID patients in the hospital. This is likely now starting to include the Thanksgiving holiday weekend, but probably not the full effect just yet. When will it peak and when will it start coming back down? We just don't know. Now, our ICU capacity remains good, and that is reassuring. But ICU capacity across the region is a concern, and we have neighboring counties whose numbers of hospitalization, including ICU, are also going up just like ours. And we're all working together, so we will be sharing ICU bed capacity across the region. And if we look at just 3 of our neighboring counties, by example, Santa Clara County, San Francisco County, and Contra Costa County, you can see that they're all going consistently up in terms of hospitalizations, just like we are here in Alameda County. So while it is good that we do have ICU capacity now, we need to be concerned with the overall region's ICU capacity, especially because, again, we just don't know when any of us will reach that peak and begin to come back down. Daily cases in the county continue to rise as well, as we've been showing you for the last couple of weeks, and I wanted to show you what we are seeing at our testing site specifically. As you can see here, this is showing the number of positives compared to the overall number we tested, or the positivity rate for the last month or so. As you can see, the percentage of positives is climbing significantly. The main question we have been getting is why? Why are we seeing a spike right now? And it's a great question, especially because the surge in cases was starting well before the Thanksgiving holiday weekend. It is continuing to rise following the holiday weekend, but again, we started to see the uptick in cases sooner, so we can't blame it entirely on the holiday weekend. We began seeing an uptick in early November, which means when we work backwards that this would reflect people being exposed and contracting COVID starting around late October. You may recall that Alameda County entered the orange tier, and on October 23rd, a number of restrictions were loosened up and things that were previously not allowed were permitted again. Of course, we might guess that this led to more mixing and more gathering, businesses opening back up and more people going back to work, all of this potentially leading to more exposure and more cases. So to get a better understanding of what is going on, we took a closer look at positive cases at Roots East Oakland testing site. Here you can see most likely source for Oakland residents who tested positive at our site. We looked at about the last 6 weeks, and then we compared that with the 6 weeks before that. And I want to call your attention to most likely causes. Taking a look at the blue slice, that reflects those whose most likely source was within their own home. That has been the largest most likely source basically since the beginning of our testing efforts, and it remains the most likely source among those we have tested. Looking at the red slice, that's the workplace, and that has been the second most likely source for some time as well. The yellow slice represents those who likely contracted it from an individual outside the home, and this is typically a family member, a coworker, or a friend who tested positive for COVID. And that has been in third place for some time now. But what I want to call your attention to here is the green slice, which represents parties and gatherings. These could be weddings, funerals, or parties, as well as gatherings in people's homes or in restaurants, bars, and clubs. As you can see, this went from less than 3% of cases from October to mid-November to now 14% of cases from mid-November to now. That is just a very significant increase from 3% to 14% of positives. So again, this is Roots only data, but it is looking at 555 positive Oakland residents we tested from October 4th until now. So it gives you a window into what we are seeing in Oakland in particular. And when we drilled down further into East Oakland, we saw essentially the same pattern, with household as number 1, workplace as number 2, individual outside the home number 3, and parties and gatherings increasing significantly and helping to account for the increase overall. So whether this is from fatigue of being separated and taking all the precautions we know work, or whether it was a direct response to loosening of restrictions and people feeling like they could relax, we don't know, but we do know that parties and gatherings are a major culprit in the uptick, and this includes the holiday weekend, but is not solely accounted for by the holiday weekend. Now, I want to turn to talking about perhaps the most disturbing thing in this pandemic we have seen yet. This is something we are hearing about nationwide, but we are also seeing it right here in Alameda County, and that is the death disparity. There's just no way for me to sugarcoat it, so there it is. We have a major death disparity as it relates to COVID-19 and African Americans. Now, so far, the hardest hit community in terms of cases is our Latino, Latina, Latinx residents. And this community is experiencing by far the highest number of COVID cases in Alameda County. But what I'm talking to you about today is deaths. Take a look here at the death rate per 100,000 population. And remember, when we look at per 100,000, that helps us compare apples to apples. So this has nothing to do with how many people from each race makes up the population, because we are adjusting it to per 100,000 Alameda County residents per race. So as you can see here, African Americans are dying at almost double the rate of everyone else. Double. You can see here the rate per 100,000 for African Americans is 61 compared to overall of 33 people per 100,000. So if you are African American, you may not be the most likely of everyone to catch COVID-19, but on average, you are twice as likely to die from COVID-19. Why is this? We don't have all the answers to this yet, and we are working hard to get some specific and data-backed answers. But right now, I am reporting to you on what is and what we do know for sure. I hope you will all take heed. Now here you can see a more detailed look at this disparity month over month since the onset of the pandemic. And thank you to our colleagues at the Alameda County Public Health Department for sharing this slide with us. African American deaths are represented by this yellow line here. And as you can see, this line has stayed well above everyone else basically this entire time. With the exception of a brief moment there in May, where African American and Latino deaths were at the same rate, other than that, you can see that African American deaths are significantly higher than any other group the entire time, culminating in double the death rate of any other group. I know this is very sobering and very disturbing. We've been saying that this virus does not discriminate, but clearly we see that something is going on here. And there are lots of theories out there about why this is, but still not enough science, in our opinion, to really answer the question of what is going on. We will continue to share what we know as we learn more, but in the meantime, we want you all to have as much information as possible to make the best decisions you can for yourself, your loved ones, and your community. Like I've been saying since the very first briefing, no one is coming to save us. We must save ourselves. This goes for the vaccine too. It will not be a magic bullet. We must do what we know works in the meantime. Please stop gathering. Make other plans for these holidays. If you must check on a loved one, wear a mask, space out, make it brief, and make it outdoors if possible. Shelter indoors as much as you can, whenever you can, but only with members of your household. If you think members of your household have been exposed, you may choose to wear a mask in shared areas and keep good air circulation and distancing in your home. Don't share your air. Mask up, space out. Protect your elders and those with underlying conditions. If you think you were exposed, isolate yourself, get tested in 5 to 8 days, continue to isolate yourself until you get your results. If you have symptoms, do not go to work. Do not gather. Isolate yourself, get tested as soon as you can, and continue to isolate until you get your results. We are the only ones who can keep us safe. That concludes today's People's Health Briefing. Please submit your questions in the chat, by direct message, or email us at admin@rootsclinic.org. Thank you for joining us. Please tune in next Tuesday at 10. See you then.